السلام عليكم ورحمة الله وبركاته. Welcome my daughters and son. Today we will discuss epilepsy. What's epilepsy and what's the cause of epilepsy and how can I deal with case of epilepsy. Epilepsy is a disorder characterized by recurrent transient attack of somatic, psychic or autonomic manifestation associated with electroencephalogram changes plus or minus disturbed consciousness. A seizure is transient disturbance of cerebral function due to abnormal paroxysmal neuronal discharge in the brain. And so epilepsy is caused by or is due to increase this neuronal discharge, increase the activity of CNS neuron. Causes of epilepsy: firing of neuronal discharge may be due to unknown etiology, it is called primary or idiopathic epilepsy, or due to certain causes which are called secondary epilepsy. These causes include infection or inflammation as meningitis, trauma, tumor, hyperpyrexia, or disturbance of metabolism as hypoglycemia, or disturbance of acid-base balance and electrolytes as hypokalemia, or may be due to drugs. When epilepsy is due to drugs or caused by drug induction is called iatrogenic epilepsy. Iatrogenic epilepsy is caused by drug. It is drug induced. These drugs include tricyclic antidepressant drug, insulin, erythromycin, vitamin B6 deficiency, or sudden withdrawal of anti-epileptic drug. So, anti-epileptics shouldn't be stopped suddenly. I must do gradual withdrawal of anti-epileptic drugs. As what? This is a question for you. What are the drugs that I can't do sudden withdrawal with it? What are the drugs that need gradual withdrawal? This is a good question. Anti-epileptic reduce their effect due to decrease of sodium influx. They alter cell membrane permeability to sodium as phenytoin, valproate, and carbamazepine, or decrease calcium influx as isoxamide, or enhancing the GABA-mediated inhibition as benzodiazepine, barbiturate, and vigabatrin. As you know, GABA is ligand-gated ion channel receptor. GABA receptor is ligand-gated ion channel receptor, so GABA receptor is a part of the gate of chloride channel. When GABA combined with its receptor, it open chloride channel and cause influx of chloride, and this cause hyperpolarization, and this hyperpolarization decrease the activity of neuron, and this will decrease the activity of CNS. How can I treat epilepsy? I choose the drug according to the type of epilepsy. In generalized tonic-clonic seizure, I use phenytoin or carbamazepine, PHENOBARBITONE, or sodium valproate. In case of absence seizures or petit mal epilepsy, I use isoxamide. It is the drug of choice of petit mal epilepsy. I can use sodium valproate as a second choice, clonazepam, and trimethadone. In case of status epilepticus, which means severe persistent attack of grand mal epilepsy, this is case of emergency. I need hospital, I need ICU to treat this state. I use diazepam plus phenytoin plus phenobarbitone. Diphenylhydantoin or phenytoin. What's the mechanism of action of phenytoin? As usual, when we discuss any drug, we talk about pharmacokinetics and the pharmacodynamics. What's the pharmacodynamics of this drug? This drug blocks sodium channel, which causes stabilization of neuronal membrane to depolarization. So it inhibits depolarization and so reduce influx of calcium and it decrease excitatory neurotransmitter release. This drug inhibit noradrenaline and 5-hydroxytryptamine release and so decrease the activity of neurons. Pharmacokinetics. Pharmacokinetics include absorption, distribution, metabolism, and excretion. Oral absorption is slow, but once absorbed, it is rapidly distributed all over the body. May be given intravenous, but I can't give it by intramuscular route because it precipitates in the muscle and causes irritation. About 90% is bound to plasma protein, and this is very dangerous. A drug can displace it from plasma protein, may cause toxicity. At low dose, it obeys first order kinetic. What's the meaning of first order kinetic? But at high dose, it obeys zero order kinetic. What's the meaning of zero order kinetic? And what's the dangerous of zero order kinetic? It is highly bound to plasma protein. Its plasma half-life at 24 hours, but with increasing dose, hydroxylation becomes saturated to obey zero order kinetic, so increase in plasma concentration, resulting in drug-induced toxicity. It can precipitate toxicity by several mechanisms. It obeys in large dose zero order kinetics, so the rate of its elimination is smaller than the rate of administration, and this causes increase of its plasma concentration and they may induce toxicity. And it is highly bound to plasma protein, so if any drug has high affinity to plasma protein and they can displace it from plasma binding site as salicylate and sulfonamide, may cause toxicity of phenytoin. So use phenytoin with caution. What's the side effect of phenytoin? It causes nausea and vomiting, nystagmus, ataxia, and diplopia, and it is teratogenic. These 5 side effects are the common side effect of any epileptic drug. Any epileptic drug causes these 5 side effects: nausea and vomiting, nystagmus, ataxia, and diplopia, and it is teratogenic. With special side effects, it causes gingival hyperplasia. What's gingival hyperplasia? It is gum grow over the teeth in children, and this growth will regress after stopping of the drug. Gingival hyperplasia is characteristic for phenytoin. It causes coarsening of facial features occur in children. It causes osteomalacia due to increasing vitamin D metabolism. So, to avoid this side effect, I must or I should give vitamin D with phenytoin. Megaloblastic anemia due to decreased folic acid absorption, so I should give large amount of folic acid with phenytoin to overcome this difficulty in absorption. Phenytoin causes acne and hirsutism, maybe due to increased androgen. Teratogenic effects, fetal Hanan syndrome, cleft lip, cleft palate, congenital heart disease, gross mental retardation, and slowing of growth. This is the characteristic feature of the fetus of pregnant female take diphenylhydantoin during pregnancy. It causes several teratogenic effects. It causes several abnormalities to the patient or to the fetus. Congenital heart disease include ASD and VSD. And lastly, it is hepatotoxic. It is very dangerous drug. It is very dangerous drug. I must take it with caution. What's the uses of diphenylhydantoin? I can use it in grand mal epilepsy, psychomotor epilepsy, and status epilepticus. I can use it in all types of epilepsy except petit mal epilepsy. I can use it in ventricular arrhythmia as it is sodium channel blocker. I can use it in treatment of trigeminal neuralgia and post-herpetic pain. Drug interaction of phenytoin. Inhibition of microsomal metabolism of phenytoin in the liver by any drug which acts as hepatic macrosomal enzyme inhibitor as chloramphenicol, dicumarol, cimetidine, sulfonamide, isoniazid. These drugs which inhibit metabolism of itself and any drug taken with it will increase plasma concentration of phenytoin. So I must take it with caution and I must take a good history of my patient because I fear from toxicity. Stimulation of macrosomal metabolism of phenytoin by any drug that cause or act as hepatic macrosomal enzyme inducer as androgen, carbamazepine. This drug will decrease plasma concentration of phenytoin as it increases its metabolism. So I must increase the dose of phenytoin. Phenytoin itself is liver or hepatic macrosomal enzyme inducer. So I need to increase the dose with time. It increases the metabolism of itself and of any drug taken with it. It increases the metabolism of other anti-epileptic, other coagulant, and oral contraceptive pills. And the females that take oral contraceptive pills with phenytoin may become pregnant. And this phenytoin may cause fetal abnormality. So take care and take good history of your patient. The second drug is carbamazepine or TEGRETOL. The mechanism of action is similar to phenytoin. It acts on sodium channel. It blocks sodium channel in the brain and so reduces the propagation of abnormal impulse. It may also inhibit release and reuptake of noradrenaline, and this will reduce the brain activity. What's the use of carbamazepine? It is the drug of choice for all partial seizures, simple and complex, and for grand mal epilepsy and trigeminal neuralgia. What's the pharmacokinetics of carbamazepine, which include absorption, distribution, metabolism, and excretion? It is absorbed slowly after oral administration, enter brain rapidly because if it's high lipid solubility. It has the same mechanism like phenytoin. It is enzyme inducers. All anti-epileptic drugs are enzyme inducer except sodium valproate, which is enzyme inhibitor. It is macrosomal enzyme inhibitor. So all anti-epileptic drugs are hepatic macrosomal enzyme inducer except sodium valproate. And this may clarify why I increase the dose with time to maintain the anti-epileptic effect. This enzyme inducer increasing the metabolism of itself and the other anticonvulsant at phenytoin, pyrimidine, clonazepam, and valproate. So its plasma half-life decrease after chronic administration. So I should increase the dose to have the previous effect. It is used an anti-epileptic drug. It is used as anti-epileptic drug and in trigeminal neuralgia. Side effect, it looks like the side effect of phenytoin. It causes the 5 famous side effects of any epileptic drug. It causes nausea, vomiting, nystagmus, ataxia, diplopia, and teratogenicity. It may cause sedation. It causes agranulocytosis due to bone marrow depression, aplastic anemia, thrombocytopenia. It is hepatotoxic. So we should do frequent liver function tests. Most of anti-epileptic drugs are hepatotoxic. Phenobarbitone. It is one of barbiturates. It is enzyme inducer. As I told you that all anti-epileptic drugs are enzyme inducer except what? Good. It enhances GABA activity in the brain, elevates seizure threshold, and limiting the spread of the seizure discharge in the brain. As I told you, GABA is one of ligand-gated ion channel receptor. So when GABA combined with its receptor, it opens chloride channel and cause chloride influx, which cause hyperpolarization, and this reduces the activity of neuron. This reduces the activity of neuron. Ezoxamide. Ezoxamide, it is the drug of choice in petit mal epilepsy. Why it is the drug of choice? Maybe due to its less dangerous side effects. It reduces propagation of abnormal electrical activity in the brain. It acts on calcium channel. Phenytoin and carbamazepine block sodium channel, while ezoxamide block calcium channels. And this reduces threshold spikes responsible for neuronal activity that generate petit mal epilepsy. It is the safest and the most effective drug in case of petit mal epilepsy. What's the side effect of ezoxamide? As any anti-epileptic drug, It causes the five famous side effect: nausea and vomiting, nystagmus, ataxia, and diplopia, and it is teratogenic. It may cause bone marrow depression, but it is still the safest and the most effective drug in petit mal epilepsy. Sodium valproate or dibakine. It is broad spectrum anti-epileptic drug, but it is usually the second choice. What's the pharmacodynamics and the pharmacokinetics of the drug? Pharmacokinetics: it is orally rapidly absorbed, while carbamazepine and phenytoin, they are slowly absorbed orally. As other anti-epileptic drug, it combined with plasma protein, 90% bound to plasma protein, and so if any drug has high affinity for plasma protein, can displace this drug, sodium valproate, from plasma binding site, and this causes toxicity. 3% of excreted unchanged in urine. It metabolized by P500 450, but not induce it. It is not hepatic macrosomal enzyme inducer. The reverse is right. It is the only anti-epileptic drug that acts as hepatic macrosomal enzyme inhibitor, and so it inhibits the metabolism of itself and the any drug taken with it. I can use it in all types of epilepsy, but it is not the first choice. Don't use sodium valproate as first choice in any type of epilepsy due to its adverse effects, or with liver disease and the coagulation disorder. What's the side effect of dibakine or sodium valproate or valproic acid? All these are names of sodium valproate. It causes the five famous side effects of any anti-epileptic drug. It causes nausea, vomiting, ataxia, nystagmus, diplopia, and decrease mental concentration due to decrease of neuronal activity, and it is teratogenic. It causes hepatotoxicity and reduce the growth of the hair. It causes alopecia and weight gain. What other drugs that cause alopecia? This is a question. It may cause bleeding due to decreased platelet aggregation or decreased platelet count due to thrombocytopenia. And this is why I can't use it with coagulation disorder. Rarely, it may cause pancreatitis in children. Acetazolamide or Diamox. You remember it. This carbonic anhydrase inhibitor. It is one of diuretic. It is useful in petit mal epilepsy, not in grand mal epilepsy. Its side effects include acidosis, hypokalemia, alkaline urine, and sedation. And the mechanism of action of Diamox or acetazolamide may be it reduces the edema of the brain, may reduce cerebral edema, which may be the cause of convulsion or seizures. I use it in petit mal epilepsy, and it is useful in petit mal epilepsy, but I can't use it in grand mal epilepsy. New anti-epileptic drugs. These include lamotrigine, vigabatrin, gabapentin, felbamate, tiagabine, topiramate, levetiracetam, and carbamazepine. Most of them have the suffix GABA, vigabatrin, gabantine, tiagabine, and those which has the suffix GABA act on GABA. Lamotrigine, it looks like phenytoin and carbamazepine. It blocks sodium channel and glutamate receptor. Glutamate is one of the excitatory neurotransmitter in CNS. When I block it, I reduce the cerebral activity. It is used in partial seizure. Vigabatrin contains the suffix GABA. It is irreversible inhibitor of GABA. It is irreversible inhibitor of GABA transmitters. This GABA transmitter which is responsible for degeneration of GABA. When I inhibit this enzyme, I inhibit degeneration of GABA, and so I prolong the action of GABA. I use the vigabatrin in treatment of partial seizure. Gabantine contains the suffix GABA. It is promoting GABA release used in partial seizure, and they can use it in migraine and neuropathic pain. Felbamate, it blocks sodium and calcium channel and the glutamate receptor. It may be looks like lamotrigine. Both not contain GABA suffix, act on sodium channel and the glutamate receptor. Tiagabine contain GABA, suffix GABA. It blocks GABA transporter used in partial seizure. Topiramate, it blocks glutamate receptors and increase GABA effect used in partial seizures. Most of them used in partial seizures, but I can't use them alone in treatment of grand mal epilepsy. What's the side effect of these new anti-epileptic drugs? As usual, sedation, ataxia, weight loss, and renal stones. Levetiracetam, used in epilepsy refractory to other drugs. And oxacarbazine looks like carbamazepine. So I can use this drug as adjuvant drug, but I can't use them alone in treatment of grand mal epilepsy. Status epilepticus. What's the definition of status epilepticus? It is generalized convulsive fits which occur with much frequency that the patient doesn't recover consciousness between attacks, and they may lead to exhaustion and death. This is emergency. This is need ICU. Treatment of status epilepticus. I must take care of vital signs, especially respiration. I prevent swallowing of the tongue. I care of airway and prevent its obstruction. I give oxygen supply. Drug therapy of status epilepticus include phenytoin or benzodiazepine slowly intravenous, because it is emergency. I can't use oral route. Phenobarbitone, intramuscular or intravenous. diazepam slowly intravenous. Why I can't give phenytoin by intramuscular route? This is a question for you. Thank you, my daughters and sons.